Welcome back to Breakfast Television. A COVID-19 vaccine will soon be available to kids under 5 in Canada, offering protection for the youngest age group as several provinces deal with another Omicron-driven wave of the virus. Joining us now to talk about how the latest development in this is pediatrician Dr. Dan Flanders. Dr. Flanders, good morning to you.
Good morning. How are you?
I'm good. How are you?
I'm great, thanks. Thanks for having me on.
Of course. I know a lot of parents are probably going to have some questions for you, so let's get into some of them now. What is your advice for parents who want to know how long children should wait to be vaccinated if they've recently tested positive or are showing symptoms?
Yeah, so if a child's already had COVID and tested positive, then it's recommended to wait a good 3 months until they get the vaccination. The idea being that once you've been infected, there's a certain period of time after that where you have really good immunity, and it's not as important to get the vaccine during that period. And then after that 3-month period, it is important to then go and get the vaccine.
And I know this is an announcement that many people have been waiting for here. How will this help improve immunity for community overall?
Yeah, so this is a really important sort of landmark moment. So 2.5 years into the pandemic, we could finally say that the whole spectrum of our community, all the way down to 6 months of age, is now eligible to get the vaccine. Until now, there's been a pocket of people 6 months to 5 years who weren't eligible, and that became a kind of reservoir where the vaccine could sort of stay and transmit and then continue transmitting to the community. But if we can get that group, that 6 months to 5 year group, sort of well protected, then we can say our whole community, the whole spectrum, is immune, and that will be an extremely effective way of getting us to the end of this pandemic.
Dr. Flanders, what advice do you have for parents who may be hesitant to give their kids this vaccine?
Yeah, I think the best thing that a parent can do is to touch base with their primary care provider, the doctor for their child. I think, everyone's situation is unique, and although the vaccine is recommended for almost everyone, every parent has issues, or there's specific things about their children's health that they want to address with their doctor before they make the decision for their kids. And the best people to make decisions for children are their parents. So a good conversation with the doctor or the nurse practitioner, the primary care provider, would be very, very helpful to sort of get parents to a place where they're comfortable making the best decision they can for their kids.
Okay, let's slightly switch gears here and talk a little bit about what other child-related illnesses have you been seeing appearing?
Yeah, so it's a really interesting time. This spring, we really sort of let go of a lot of the mitigation measures, the masking and the closing of schools, and sort of all of these measures, these public health measures that kind of brought us inside and prevented us from sort of interacting with humans for the past 2 years. All of a sudden, all those sort of lifted, and now this is an opportunity for all of the respiratory viruses, gastrointestinal viruses, to sort of get back out and take hold and transmit through our community. So we're seeing so many respiratory illnesses, gastrointestinal illnesses. It's as if we're in the middle of the winter, but
wow.
it's obviously July, and so it kind of complicates things because so many of these infections sort of look similar to COVID, so it's hard to know what is what. Mm-hmm. The best thing you can do if your child is sick is get in touch with your primary care provider for sort of next steps.
And we've real quickly here, we've been seeing kind of some empty shelves here. Are there any shortages of children's medications at all?
Because of all the supply chain problems that have been going through our economy the past few years, there have been medications that have gone into back order, difficult to find. For example, some ADHD medications recently, okay. But those are usually one-offs. I would say in general, medications are still in reasonable supply for children.
Okay, that's good to know. Dr. Dan Flanders joining us this morning. Thank you so much.